our health and wellness center that we have in Yorkton, we've got a regular weekly meeting that we have where all of us come together, and that helps us building that relationship and communication, and everybody feels part of that, and I think that helps quite a bit just with getting everybody on the same page, just sharing information, sharing what is good, what is working, what is not working. I think that helps a lot. In our facility, we've got the dietitian, diabetes educator, the exercise therapist, our pharmacist. We're all working what we call the hub in the center, and so we see each other in between, and there's that mutual respect that just develops out of being in a common location. Every week when we have our weekly meeting, we ask for events that had happened, we ask for it to be reported, and we kind of brainstorm on what are things that we can do. We do have an active occupational health and safety committee that is quite active, and they come up with ideas. Also on our regular scheduled meetings, we have where we review our like code silver or code red for a fire, or if there's an armed assailant, we review the whole procedure of what we would do. So just for the general safety things, we have that culture that we've installed of being prepared. And we've had a few fire drills that we've practiced, and that kind of just sets the tone of being comfortable to report things when they do happen.
Let's talk about that weekly meeting a bit. How long are those meetings? How do you schedule them so that everybody is available?
We pick the day of the week that most of the providers are there. So we pick Thursday morning. It's always at the same time. It's at 8:30, so everybody knows 8:30 on a Thursday morning is when we have it. It's not a traditional meeting, so it's not where we sit down and have a traditional meeting. It's our weekly get-together. We stand in front of our whiteboard where we have all of our things that we monitor, all of the issues that are there in the different categories of where they are, and then different people come up to the front and discuss what is happening in their specific area.
How long do they last?
They last about half an hour.
And is it a mandatory meeting?
Yes, it is mandatory, but sometimes there are things that keep people away from it. And there are some providers that only work some days of the week, and those might be that they are not there on that specific day. But if you're there, everybody has to be there, and we include everybody. Everybody's part. It's not only for providers, so our clinic assistants are there, our people that help room our patients in the rooms, people working with cleaning. Everybody is part of that meeting. As a region, we try to get the message across that whenever something goes wrong, we have to look at the system that did not support the individual for things to go wrong. And we need to build a system that supports people so that they can do what is best, because nobody comes to work trying to harm somebody else or do the wrong thing. Everybody comes to work wanting to provide the best for the patients that are out there, and we know that, and that is why we don't focus on the individual. We just focus on what are the system improvements that we can do so that these things don't happen again.
And does your team feel appreciated and acknowledged for their hard work, and how do they know that, if they do feel appreciated?
When I saw some of the questions that you might be asking, I actually put them on a piece of paper and I handed it out this past week, and I gave it to all of the staff, and I got 15 or 20 responses back from them, and for the majority of them, they agreed that that does happen.
And how? Did they give you some examples of how they feel appreciated?
The examples that they gave was at the wall, and then also a direct supervisor that tells them, and their colleagues and their counterparts that would acknowledge when they've done something that was just going above and beyond.